Welcome back, guys. Today we are going to see tumor. We are going to look at definition, type, characteristic, sign and symptom, investigation, and common management of tumor. I'm going to look at the general overview. So tumor is a mass of cells similar to the one of the body tissue, and then in this similarity they are growing at the body expense, but they serve no purpose in the body. For example, if you have nasal polyp, does it serve any purpose in the body? Let's look at the type of tumor. Type of tumor, we have simple tumor, benign tumor, and then we have malignant tumor, and that one is cancerous. The causes. So the cause and the predisposing factor. Number one, the cause of cancer is unknown. Causes of tumors are unknown. Predisposing factor are hereditary. 2, we have infection that is chronic. Mostly this one is inflammatory infection, and then exposure to radiation, it destroys the cell. And then we have exposure also to chemical. We have excessive alcohol consumption, raise, and then cigarette smoking. And smoking, you know what kind of cancer does it bring? It predisposes to lung cancer. And then we have ignorance. This one is when you don't know about cancer, and in case the sign and symptom have started and you go to the maybe nearby drug shop without prescription, you go and buy painkillers and you say to relieve pain, instead of us going to the hospital and seeing what is the problem. Let's see the naming of tumor. Tumors are named according to the tissue of origin. So number one, we have lipomas, growing from fat tissue. Or cells. No, cells combine to form tissue. We have myomas. This one grows from muscles and blood vessels. So we have adenoma. This one grows from fibrous tissues, from the thin layer of fibrous tissues lining the inner organ gland. Thin layer of fibrous tissues. We have fibromas. This can grow from tissue found in any organ. Found in any organ. Example, in the uterus. In the uterus, called fibroid. We have osteoma. Osteo means bones. They grow from the bone. And then we have papilloma, is from epithelial tissues. We have odontoma. This one grows from the teeth. Angioma. Angioma is from the blood vessels. You have melanoma. So melanin, remember melanin. This one grows from the pigmented cells. Pigmented cells. The characteristics of simple tumor. And in simple tumors, they are in capsules form, like these cells are here. So this is tumors and this is capsule. So let's derive our characteristic from here. 1, they are in capsule form, capsulated. 2, they don't invade the nearby organ. They grow slowly. They grow very slowly. They are painless. They are painless. They are not very vascularized. Vascularized mean supplied by blood vessels, not vascularized. After removal, they don't reoccur. After removal, and for them they don't kill. So that is all for the word. For the simple tumor, that is benign. Let's look at the malignant tumor, characteristics of malignant tumor. So let's pick the opposite. For them, they are like this. This is the cells. For them, they are not encapsulated form. That's why that's the opposite of the simple tumor. 1, for them they are not in capsule form, capsulated. 2, they are painful. They are painful because they irritate the one. Due to their growing, they irritate the nerves. Painful. And they are very vascularized, well vascularized. That's why in case of any temper to touch the tumor, it bleeds. It bleeds a lot, and then for them they can kill. They can invade nearby organ. And then for this type of tumor, they can reoccur after removal. That's why if someone has been removed, if the tumor has been removed and the tumor was malignant, the patient has to be put to anti-cancer drugs, or the patient has to go through radiotherapy plus all the palliative care. So how do tumors spread? The spread of tumors spread by metastasis. This means the cancer cells is transported by blood vessels, blood and lymphatic stream to the nearby organ. Number 2, we have by contact. This one is by affected organ being in contact with non-affected organ for long time. And then we have by local spread. This one, the tumor grows until it invade the nearby organ by surgery. So during surgery, the tumor cells can be transferred from one organ to another. Then by transperitoneal implantation. In this case, the cancerous cells shed and then deposit itself to another organ. What are some of the investigation that is done to someone having tumor? Investigation. So number 1, we have X-rays. Number 2, we have ultrasound scan. Number 3, we have biopsy. This one, you take the portion of the cells and you take for histology. Then we can do, for X-ray, can see the size. Even ultrasound scan can see the size and the type. Biopsy can help in the staging also. And then we have magnetic resonance imaging. This one can also show the nature of the tumor and its location, whether in the brain, blood vessels. Then we have fluoroscopy. fluoroscopy. This one will look at the movement throughout the body, and this one also is used in combination with X-ray. So those are the investigations that can be done to someone having tumor. So let's look at the management. What people use or they can use for managing a patient with tumor. One, we have surgery. Surgery mostly in early stage. So that's why staging of cancer is very important. Staging of tumor. Like for simple tumor, there is no need for staging. Just go and remove. Number 2, we have chemotherapy. This is the drug that destroys the cancer cells in the body. Number 3, we have radiotherapy. This is burning of the cancer cells. So number 4, we have palliative care. So in this care, mostly is given to those whose the stage has gone to stage 3, stage 4, because they can no longer do anything to help the patient. So in this management, they manage pain and psychologically. So that is all. Thank you, and see you in the next one.